Is there any vitamin that can prevent a blood clot from forming in the leg or actually improve circulation? The answer is more important than it seems because some vitamins help keep blood vessels healthy, but none of them can dissolve a thrombosis. Confusing these two things can lead someone to rely on supplements and delay seeking the right treatment. That doesn't mean vitamins are useless for circulation. They play a role in tissue formation, blood function, and in maintaining the balance of coagulation. The problem starts when this natural role is turned into promises of thinning the blood, cleaning out veins, or replacing medications. Unfortunately, a lot of videos generated by artificial intelligence have been circulating with these promises, not just in the title and thumbnail, but actually within the content itself. And it's likely that the thumbnail for my video here also has some phrase like that to grab your attention. Because if I don't do that, it's almost impossible to get you to click and watch my video. People today are much more likely to click on videos with bold promises, unfortunately. That said, I need you to really remember what I'm about to say. When a clot has already formed, a medical evaluation is necessary, and, in many cases, the use of anticoagulants. No vitamin capsule can take the place of that. But then, what is the real role of these nutrients, Tenorio? Vitamin C is a good starting point because it helps in the production of collagen, a protein that helps maintain the structure and strength of blood vessels. Fruits like oranges, guava, kiwi, and strawberries, as well as foods like bell peppers and broccoli, are good sources of this vitamin. Maintaining an adequate intake is part of a diet that supports vascular health. However, there is no evidence that large doses in capsules, and supplements can clear veins, dissolve clots, or prevent thrombosis. The same caution applies to vitamins B6, B9, and B12. They help the body control homocysteine, a substance naturally produced by the body. When there is a deficiency of these vitamins, homocysteine can build up in the blood, and high levels are associated with a greater cardiovascular risk. Because of this, it might seem logical to believe that taking supplements, would solve the problem. But research results have brought an important reality check. Vitamins can lower homocysteine, but this reduction hasn't consistently translated into fewer heart attacks, cardiovascular problems, or blood clots in the veins. That doesn't mean, pay attention, that doesn't mean a deficiency should be ignored. A lack of vitamin B12, for example, can be more common after the age of 50, especially when there are absorption problems in the stomach or intestines. Long-term use of certain medications and specific digestive surgeries can also make it harder for the body to absorb it. In these cases, correcting the deficiency is indeed very important. The mistake is taking these vitamins without needing them, believing they'll work as a general protection against thrombosis. Well, but before we talk about the other vitamins, which are also very important, if you want to follow shorter content and everyday tips, follow me on Instagram. There, I always share health information with shorter videos. And don't forget to subscribe here to the channel and turn on the notification bell. Here, the content's longer, but I try to bring you the best information possible so you can learn to take better care of yourself. Continuing. With vitamin D, something similar happens. People with low levels of this vitamin often also have conditions that increase circulatory risk, such as obesity, low mobility, advanced age, or chronic diseases. This shows an association, but it doesn't necessarily mean that the lack of vitamin D caused the problem. So far, supplementing everyone indiscriminately has not been shown to prevent venous thrombosis or consistently reduce cardiovascular events. Those who have a real deficiency should indeed correct it, mainly because of its importance for bones and muscles, but they shouldn't see it as a natural anticoagulant. Vitamin E, on the other hand, deserves special attention because in high doses it can interfere with the action of platelets, those small structures in the blood that help control bleeding. That's exactly where its reputation for thinning the blood comes from. However, this effect hasn't shown reliable cardiovascular protection and can even increase the risk of bleeding. Extra caution is needed for those who use anticoagulants or medications that reduce platelet action, like aspirin. In these situations, starting to take vitamin E on your own can pose more risks than benefits. Another important vitamin to mention is vitamin K. When people hear that vitamin K is involved in blood clotting, some start to see it as an enemy of circulation, but it's actually necessary for the body to control bleeding normally. Eating kale, spinach, broccoli, and other vegetables rich in vitamin K does not automatically cause thrombosis. In fact, cutting out these foods can make your diet less nutritious. The main concern is for people who use warfarin, a type of anticoagulant. These people don't need to give up vegetables, but they should avoid sudden changes in the amount they eat, since that can affect how the medication works. It's also common to see claims that vitamin K2 can remove calcium from arteries or clean blood vessels. There are studies looking at its relationship with arterial calcification, but that doesn't mean it treats clots in the veins. Venous thrombosis and the buildup of plaques in the arteries are different problems and shouldn't be treated as if they're the same thing. Given all this, what would be the best vitamin for circulation? The most honest answer is the one you're actually lacking. The need can vary depending on your diet, age, your body's ability to absorb nutrients, existing health conditions, and the medications you use. That's why mixing several capsules hoping to prevent clots is usually much less helpful than maintaining a varied diet and only correcting the deficiencies that have been identified. Besides that, some habits are much more important for preventing thrombosis than any vitamin. Moving your legs, avoiding sitting for long hours, not smoking, keeping your weight under control, following post-surgery instructions, and using prescribed medications correctly are all more relevant measures. People who spend long periods traveling should also stand up when possible and regularly move their feet and legs. And it's essential to recognize the warning signs, okay? So pay attention. Swelling, pain, a feeling of warmth, or a change in color, especially when these symptoms appear in just one leg, require a quick evaluation. Sudden shortness of breath, with or without chest pain, dizziness, or fainting could mean the clot has reached the lungs. And in this situation, you need to seek emergency care. The main message is simple. Vitamins help your body function properly, but they are not a treatment for thrombosis. I'll stop here for now. God bless you, take care, and a big hug.